Have you heard about medical coding, but you don't know what it is, but you want to? Sit down. Let's talk about this. Medical coding is like translating a doctor's handwritten story into a secret set of numbers and letters that anyone in healthcare can understand. These medical codes transform complex patient information into a language that insurance companies, hospitals, and government agencies use worldwide. Every diagnosis, treatment, or piece of equipment that's used during a visit gets its own special code. Much like every book has a unique ISBN number, thereby creating a universal language. Coding serves as the critical bridge between clinical documentation and healthcare administration. This systemic translation process enables efficient communication among healthcare providers, insurance companies, and regulatory agencies, forming the backbone of modern healthcare operations. Medical coders serve as the healthcare detectives, meticulously reviewing clinical documentation like a doctor's note, lab reports, or diagnostic images. They translate complex medical scenarios into precise alphanumeric codes using specialized reference materials and digital tools. Each patient encounter, from a simple vaccination to a complex surgery, requires careful analysis to assign the exact code that will determine billing, reimbursement, and create an accurate medical record. Coders must possess extensive knowledge of medical terminology, anatomy, treatment, and constantly evolving coding guidelines. They build the critical link between clinical care and the insurance claims that ensure healthcare providers receive proper payment for services rendered. Using comprehensive coding manuals like your ICD-10, your CPT, and HCPCS codes, assign specific alphanumeric codes to every aspect of a patient's care. The coding process transforms narrative descriptions of patient conditions and treatments into standardized data points. So, for example, when a patient visits a doctor for a broken arm, the medical coder must correctly identify and assign codes for the specific bone fracture, any diagnostic imaging that was performed, the treatment methods that were used, medical supplies that were provided, and any follow-up care that's recommended. This requires not only familiarity with thousands of possible codes, but also an understanding of medical terminology, anatomy, disease processes, and treatment protocols. Accuracy in medical coding is paramount, as these codes directly impact healthcare reimbursement, research, and public health monitoring. Coders must stay current with frequent updates to coding guidelines and regulations, often requiring ongoing education and certification. They function as part validator, part investigator, sometimes needing to query the physician for clarification when documentation is ambiguous or is incomplete. This collaboration ensures that the coded data accurately reflects the services provided and the medical necessity for those services. The final product of a medical coder's work becomes the foundation for the claim submission process. These coded claims are sent to insurance companies or government payers who use the codes to determine appropriate reimbursement amounts for healthcare providers. Through their meticulous work, medical coders ensure that healthcare facilities receive proper compensation for services rendered while maintaining compliance with ever-evolving healthcare regulations.